Warm welcome to all of you, um, the respected team of Banyan, dear parents, and all of you out there. I'm Dr. Divya, and I've been in this telemedicine field since 2 years and been taking care of COVID care, especially in this telemedicine since 2 years. So, right from the beginning of this pandemic. Yes, it is important that we know and have access to the right information so that we know what to do and how to react because we do have the memories of the last year which were filled with panic and anxiousness. Using all that, let's start the topic right away. So today I'm giving you awareness about what to do, be it an adult or a child who is getting infected with Omicron. So with this, I hope by the end of this talk, you have knowledge and that confidence that you can face it. Okay. Am I audible? And I started now?
Yeah.
Thank you. So, what is COVID-19? So, in the beginning of the year 2019, these words have made the newspapers. COVID-19 is here. So, it is actually a virus named as severe acute respiratory syndrome virus. So, after that, it has immediately evolved into a global pandemic. So, along with this evolution, over the years, it has evolved into mutants. So right now we hear so many names like Delmicron, Delta, SARS-CoV, Omicron, IDH, Fluron. So these are all the parts of its evolution. So as the virus is also evolving, our healthcare system is also evolving along with it to know more and more about this and protect the people. So the first one was Alpha, the last year, which made huge news for the Delta. And this year we have the guest of honor, which is Omicron variant. And scientists do say that we have more of the mutants to come soon. So whatever may be the mutant and whatever may be its mutations, the mode of transmission is the same. So it is transmitted to the droplets. So let's know what about Omicron. So Omicron is discovered recently in South Africa around November, but it's very highly transmissible. So it is so highly transmitted that in November it was discovered, and by Jan it again became a global pandemic. So why is it a concern? Because Omicron has 30 mutations, which are more than that of a Delta. So we are a bit concerned that can this be prevented by our immune system? So the next question which is following it is, do the vaccines work? Yes, most likely so far it has been observed that vaccines are giving the immunity to protect us. So, be it, as I said, be it whatever variant it can be, the most common mode of transmission is the droplets. So, when a COVID positive patient either coughs, sneezes, or even blows his nose, the droplets with the live virus are released. So, when these are released in the air, you can see that these are viable. So, they travel a distance, and whoever is in the vicinity, they infect the healthy person. So when a COVID positive patient coughs, sneezes, or even blows his nose, the virus within these droplets is active. So it travels to a certain distance, and when a person comes in contact with these droplets, they enter the person. So that is how the transmission occurs from one person to other. Of late, recently, other modes of transmission has also been observed. That is, when these droplets travel, they may fall onto the surfaces like our cell phone, glass counters, the utensils we use, even the door knobs. So this is the another mode of transmission so far observed. So this is an indirect way. The other possible way is like even the fecal-oral way. So when you use the same bathroom as the infected person, the chances of transmission are seen. So basically, this is the outline of a talk. So once we know the transmission and once we know that the virus has entered, so we start with the symptoms. So regarding the symptoms in adults, it has been observed that Omicron variant is causing body pains, sore throat, headache, much more common than fever and dry cough. So of late, I think in my day-to-day practice, I've observed many people saying it all began with a sore throat. or an itching in the throat. So so when you have an itching throat or sore throat, just be watchful that this can even be an Omicron. Along with high pulse rate and nighttime sweating and vomiting have also been added recently. So an uneventful episode of vomiting or all of a sudden burst of sweating while you're sleeping, or even chills without any fever, all these are categorized under the symptoms. Now, coming to the symptoms in children, which we are more and more concerned. So, children also have been observed to present with the following symptoms like fever, running nose, throat pain, headache, body aches, dry coughs, and diarrhea. We are known that children can cause headache to others, but children do complaining of headache is also something we should be observed for. And of late, it has also been observed that all of a sudden, children are presenting with diarrhea before it turns into a Omicron variant symptom. So how can we differentiate between COVID and Omicron? I mean, the last year's Delta and the Omicron symptoms. So Omicron is usually having a scenario of upper respiratory tract, that is involving your nose and your throat. So they are mostly sore throat, dry cough, a little bit of, more headache, very severe intense sometimes, along with body pains. Or if you are a friend or a parent at home, you have observed someone is showing these symptoms, what do you do next? The most important thing you can do for yourself or your family is isolate the person. Isolate as early as possible, as soon as you notice the change in the symptoms, and then call a doctor. So, why did I say here telemedicine? Because you going out to a hospital also increases chance of transmission to other people outside. So, isolate yourself, call a doctor via the telemedicine, and immediately start the consultation and follow his advice. Then, what do? A lab test is required to prove that RT-PCR is positive or negative. So, who are advised this? Suspicious case, contact person, symptomatic, or even an asymptomatic person is advised RT-PCR. So, what is the day and the correct time to go for a testing? So, usually, when a COVID positive case is on a consultation with me on a phone call or visit, what do we actually start from day one? That is the day of the symptoms which he has noticed. Like he says, yesterday is my day one where I noticed a sore throat. So that is day one. Counting from that day, day four, day five is a good time for an RT-PCR sample. RT-PCR is still the golden diagnostic method to identify cases. So often we also hear about rapid antigen. So rapid antigen is a quick test which you can do at various outports like an airport or your travel place or at the hospital nearby, or you even have self kits available now. And of late, Tata is also releasing an Omnisure kit where you can test at the comfort of your home. So, what are the guidelines? These are released by the Indian government. So, patient must take rest, drink lots of fluids, and maintain adequate hydration. Because in cold and cough, there is a lots of water from your body, even in fever, because of the high temperatures. So, maintaining adequate hydration is very important. Follow all the respiratory etiquettes. What do you mean by a respiratory etiquette? So, even when you're in isolation, you get cough, you get sneezing, you need to blow out your nose. So you dispose the tissues immediately rather than keeping it on the surface, as this virus can be viable even on the surface for at least 4 to 7 hours. Wash your hands with soap and water as often as possible, or at least use alcohol-based sanitizer. Do not share your items which you have touched, like during this period of isolation, especially like remotes, linen, even bed sheets, clothes, utensils. Clean all the frequently touched surfaces with 1% hypochlorite solution. And the most utmost important point in isolation is monitoring. How do you monitor yourself? You need a beautiful device called pulse oxygen meter. This is supposed to be a beautiful device to be present in everybody's house. So this is a pulse oxygen meter, which is battery operated. So you need to insert your finger into this, most preferably the index finger, but make sure you don't have nail polish or mehendi while you're placing in it. So this can actually get wrong readings because of that. Okay, so once you place, the readings fluctuate a bit, and after a minute they settle. So and flashes the final number. So take that. So pulse oxygen meter is used to know the saturation of oxygen in your blood, and what is your pulse rate. These two are very, very important criteria for your doctor who's treating you, even in a virtual media, to know your progress. For instance, I have a patient who calls me saying, "Oh, doctor, my oxygen is above 96 and my pulse rate is around 72." So it's doing very good. In fact, it's progressing very well. So he's on the road for recovery. So if there is another person who says my oxygen levels is below 95, sometimes it's going to 90, then that is an alarm bell where I should advise him to please go and visit a hospital. You need some oxygen. Okay, this is how oxygen helps us. This pulse oximeter helps us. So once you went inside the isolation, when do you come out? So when to discontinue it? So after 10 days of symptom onset, no fever continuously for 3 days, no rise in fever. Even after you come out from isolation, follow the self-monitor for up to 7 days. Previously, we used to have a repeat RT-PCR test, but now that has been removed. Okay, so one of the most commonly asked question, can mild cases recover at home? So this is from the World Health Organization saying that yes, mild cases can recover from home with simple supportive treatment and you can have complete recovery. So what happens when this? Luckily, we are all eagerly waiting to pass this peak, so that our kids also can go back to school happily. So once they go to school, teachers should encourage them to wear a mask. Place their seating arrangement such a way that they have safe distance apart from one another. Encourage them to wash hands as often as possible. So together we can fight the COVID, and together is how we can stop the transmission. So as a caretaker, I know it's very anxious for us, especially after the last year's very poignant memories we have. So when you are confident, you are bold enough to take care of your kid and also your family members.